everyone, how are you all? Welcome back to my channel. Thank you first of all for supporting my videos, for viewing it and commenting it and liking it. That makes me feel that the information that I provide for you according to my experience is actually useful, and it just makes me feel happy. Anyway, as many of you know, I've been an enrolled nursing student in Diploma of Nursing at TAFE for the past 18 months, and I just finished it last year. And now I'm transitioning to my Bachelor of Nursing, to the uni, to the second year. Okay, so basically I decided to create this nursing series videos where I will be sharing with you my experience, information that I've got during my studies, you know, and just tricks and tips on how the whole thing is just basically went for me. So in this video I want to share with you about your first placement. So basically when you finish your first semester of studies, you will have your very first placement, and it's going to be in the end of semester and it will last for 3 weeks. It's going to be full-time placement, which means you will be attending class from Monday to Friday. It will be no weekends for you allocated, and most of the time it will be morning shifts, or maybe for certain circumstances of some students you might be asked to be there for PM shifts, which means it will be starting roughly from 2:45 till 10:15 or 10:30 at night. Okay, so how does it go? What to expect, what you will be doing during your placement? I'll start to cover all these points in this video, and I have my notebook with the bullet points as usual, so I will stay on track. So basically, before you start your placement, they will tell you obviously 2 or 3 weeks in advance where you're going to be going, what the dates of your placement, and the time shifts as well. So basically your first placement is going to be in aged care facility. You're not going to be sent to the hospital or to GP clinics or any other places like that. Your first placement is going to be only in aged care facilities, and every student or a group of students in your class will be sent to different aged care facilities, because each care facility can take only a certain amount of students. So you might end up having maybe 5 girls or 5 boys from your class sent with you together to the same aged care facility, whereas other students will be sent to different ones in different areas. So before you start your aged care facility, you will have something called a pre-brief. This is a meeting that will be organized by your VPC facilitator that is working at TAFE campus, and that person will give you different dates and different times to choose from, because many people work, many people have family commitments, so some dates and times do not work the same for everyone. So you will be given a choice to choose your date to come. And once you attend this type of pre-brief meeting, that person who is your VPC facilitator at TAFE will give you all information about your placement. That will include your logbook, which is a book that will be given to you with the tasks that you will need to be signed off by your body at your aged care facility. Also, it will have a part with a journal where you will be writing down your reflections, your thoughts on how your placement is going, whether it's a positive or negative experience and stuff like that. And then you will have a place where you will be ticked off on your tasks and signed by your bodies, and also by a facilitator, which will be a second person who will be with you in aged care facility. The VPC facilitator at TAFE and your placement facilitator, there are 2 different people, which I will explain a little bit in details later on in this video. So that's it, you will be signed off in that book. You have to carry this book with you every day of your placement basically, and whenever you do a task that you've been asked to do in that book, you will need to be signed off on a spot. So don't gather all your tasks and then think, oh, I'm going to be signing it in the end. No, do signing in the same day, because this will be easier for you to keep a track, and it will be easier for you to find those people who were witnessing you doing this task to sign it on a spot. Then your facilitator will ask you if you will have any questions. They will answer that questions, and they will give you just a general information, like a brief information, what you will be expected to do during your placements. You know, they will give you some tips and tricks or of how to do certain things, you know, how to behave, how to communicate and stuff like that. And in a case if you have any problems, you know, or misunderstandings with any of the staff members, who to contact and what to do to stay professional, to stay polite and kind to other people. So that pretty much will be it. Then after pre-brief session, you will be starting your placement. Okay, so as I mentioned, your placement will be going strictly for 3 weeks. It's going to be full-time placement, which means you will be attending facility all 5 days a week. You're not going to be asked to do your shifts during the weekend yet. For this first placement, you will be only asked to do from Monday to Friday, and most of the time it's a morning shift, which starts roughly, depending on each facility, starts about 6:30 and finishes at 3 p.m. If you have any circumstances at your work or at your family, you may ask your VPC facilitator at TAFE to change your shifts to do PM, but there is no guarantee that your facilitator on a placement will be with you at those times, because most of facilitators go with the majority people, which if all your group that been sent to your placement, for example, attending only morning shifts, your main facilitator will be staying with the biggest group, and then you will be just attending your PM shifts on your own, and you will be buddied with one of the nurses. This is how it was for me, at least. I've done all my PM shifts, but I had one girl who couldn't do the morning shifts, so she was attending PM shifts, and I remember our facilitator was not with her at that time. So what you will be expected to do during your placement, this is probably the most important questions, because many people will be afraid and sort of like worrying to go into the real workforce with real people to look after, with real nurses to work with, who will be watching you basically, and you might think, oh, they will be judging me, you know, if I do things wrong, if I don't know things and stuff like that. So many people actually experience this sort of like a worrying feeling before they start the placement. Well, what you will be expected to do is basically what you were taught in your class in the theory part: how to look after elderly people, how to analyze the care plans, how to search things that relevant to the clinical history of that patient or that resident, and things like that. In aged care facility, you will find that most of the nurses would call patients or people who reside in an aged care facility as residents, okay, because basically for them aged care facility is their second home, because most of them go there to basically get help in their daily activities, and sadly for most of them that would be the last destination. So we treat it as it's their own home. Basically, they have their own stuff in there, they have their own furniture that they brought from the previous homes where they used to live before, they have their belongings there and valuable things that they love and treasure. So sometimes you will hear a term resident. This is how we call basically elderly people who live in aged care facilities, but they also patients, because we do provide care for them, clinical care, and we provide for them assistance as well in terms of cares. So this is it. Now your tasks, what you will be doing there. Okay, so basically one of the tasks would be you will be helping residents to shower. Okay, you will be helping to shower them. You will find different residents with different physical abilities. Some of them will need only a little bit of assistance, some of them will need even 2 people supervising them and giving them showers. Okay, you will be helping them or assisting them to go to toilet, for example, just to stay behind the person while the person is using a wheelie walker, just in a case while the person is reaching the bathroom or turning, so that person won't fall, and you just basically supervise the person by standing beside it, you know, and things like that. You will be asked to assist with feeding. Some people who have, for example, as I mentioned before, certain physical disabilities, like for example Parkinson's or dementia, they would have difficulties eating or feeding themselves. Like for example, people with Parkinson's, it's very hard for them to hold the spoon. Depends on the level of the illness and stuff like that, depends on their age as well. The older you become and you have Parkinson's, the older you become, the less your physical ability will be to hold the even spoon, you know, and carry it to the mouth. So you will need to help those people basically to eat. So you will literally feed those people. Also, people who have dementia, they would not remember that they have to eat. They will have the hunger feeling that they are hungry, and they might get even stressed and frustrated when they feel hungry, but they don't have this sort of like understanding that I need to eat. This is hunger, so the next action that I need to do to satisfy it and resolve that hunger, I need to actually eat, so they would not eat. So you will need to actually help, sit down beside them and help them to eat. You might give a spoon in their hand, you know, and watch them eating it. You might guide them a little bit, talk to them, you know. And in some cases, if dementia is really heavy, you will need to actually take the spoon and feed the person throughout the whole meal. Then you will be asked to assist with continence aid changing, because you will have some people who will be incontinent of urine and feces. Some people will be partially incontinent, some will be only incontinent in urine but continent in feces and stuff like that, again depending on physical and mental condition of a person. Then you will be asked to do hygiene care, which is you might be asked to clean the dentures, you know, or help person and guide person to brush their own teeth if they still have it, you know. What else? You might tidy up a little bit the room. Like we do have cleaners in a facility. You don't have to like literally vacuum the room and dust, you know, and clean all of that. No, you can just tidy up the bed, for example, in the morning once you assist the person with the showers, you know. While the person, let's say, is in the toilet, you might quickly do the bed, tighten up the bed, just maybe fix the pillows here and there, you know, take away the clothes to the cupboard and stuff like that, you know. So it's just the simple things, you know, it doesn't take that much of time or work. Then you will be asked to assist person in dressing up or dressing or undressing, you know, depends which time of the day it is. If someone, for example, was incontinent, you might be asked to assist the person to change and give it a wash, give the body a wash and stuff like that. Regarding the washes and showers, you will have residents who would require everyday wash, and you will have residents who would require everyday shower, and you will also have residents who would be second daily showers, which means that in between those days you will give a person a wash, which is going to be with warm towels, just sponging the body and give it a wash. What else you will be doing? Of course, as a nurse, you will come there as a nursing student, not as a carer. You will be practicing to do your OBS. So those things that I've mentioned now, this is just the daily life activities, something that every person needs, because we don't have physical problems and we are young, for example, we do it for themselves, but for the elderly people in aged care facilities, their daily life activities become really a hard part of their life that they cannot perform themselves. So basically, carers who work in aged care facilities, you know, they have to assist them with those cares. And you as a nursing student will be practicing to do those as well, because there is a misconception that some people have that when you are EN or RN, you will never be assisting person to go to shower or to toilet or changing person and stuff like that, or helping to change incontinence aids and stuff like that. That's not true. We all work as a team. Okay, there are some situations when you as a nurse will be actually changing person if there is an accident happen, you know, with urine or feces and stuff like that, or if the person was bleeding or had a fall and things like that. We all work as a team, so you need to know those things. This is why when you do your first placement, even though you will be working as EN, or maybe you will start to do your RN after your enrolled nursing diploma, you will still need to know how to perform those tasks, because it will be situations in your shifts in the future when you will start to work as a real employer, when you will need to assist other carers and AINs or ENs, you know, to do those cares. So that's pretty much it. Then for clinical perspectives, you will be doing things like observations, which is shortly called OBS. This is when you will be going to the residents and measuring their blood pressure, their temperature, their pulse, and the oxygen level. And with all of that, you will be assessing them if they're having any pain, you know, and if it's a dementia person, you will be using EBI scale, which is a scale that help you to assess a pain level by judging from the face expression and gestures and stuff like that. But you will be covering that in your theory part in class, so I'm not going to be touching on that too much. Then you will be performing your BGLs or BSLs, which means your blood glucose level in the blood by pricking the fingers. So you will have lots of people who are having diabetes in the aged care facility, and some of them will be on 2 BGLs only morning and before sleeping. Some of them will be pre-meals, so you will need to do it before breakfast, before lunch and before dinner, and then the fourth time somewhere in the middle of the night. So you will be doing that, which is really interesting in my opinion. It was quite an interesting experience for me when I was doing it first time. I was afraid to prick someone else's finger because I thought, oh, I'm giving you so much of pain. But those people doing this so many times, they don't feel much of a pain anymore because they just got used to it, because they've been living for so many years with diabetes, unfortunately, and BGL testing is something that became a part of their life in so many times a day. Also, you will be performing something that is called UI testing or ward testing, which is testing your patients for urinary tract infection, UTI in short. This will be performed by collecting urine from the patient or from the resident, you know, and using your dipsticks to dip it into the urine literally, and then see if any components lighten up to give you indication whether the person has UTI or not. You will be covering this information in your class, basically what components to look for when person has signs of UTI or person has a high glucose or ketones level in their urine and stuff like that. Also, the other part that I wanted to mention is that do not forget to use your PPE. PPE is a protective equipment, which means it's your gloves, it's your apron, it's your mask and your goggles. Depending on the situation, you will be using different parts of it. For example, if you will have a patient who is on precautions, you know, if it's a viral infection, for example, you will be using a mask. If it's a skin infection and stuff like that, you will be asked to use your apron and your gloves as well. But for all your cares, you always need to use gloves, no matter what, whether the person is on the precautions or not. You always need to use your gloves. And I've seen many nurses and carers do not use the gloves. Well, this is their own choice, but for your own safety and also for the safety of the patient, always use your gloves. And your gloves will be distributed in different parts of your facility, and you will have a sink when you will need to wash your hands. So basically, when you finish doing your cares, take off your gloves, wash your hands with the soap, and then dry it, and then you will be ready for the next patient. Put your gloves again on and repeat the whole procedure again. Sometimes I even wash my hands up to my elbow, especially when you're changing bed sheets, you know, and things like that. But this is, I guess, personal. If you want to do it or not, it's up to you, but I do sometimes that as well. Also, my tip to you, when you change someone's beds, do not flush the sheets up. Like, do not fluff the bed and stuff like this. You will be taught in a class and also in your labs when you do your practical practicing your skills and stuff like that. When you're changing someone else's bed sheets, just roll things without fluffing them up in the air. Just roll them nicely, you know, and do not like do this basically, okay? Because a lot of people shed skin, a lot of people shed together with the skin some bacteria and stuff like that. It all goes in the air. It's really small particles that you inhale with your nose or with your mouth, and it goes to your own body. So avoid that. You're not going to be wearing masks every time you change someone else's sheets, because this is just indicates maybe to the person that you might think that the person is contagious or something like that. So just follow those simple procedures, you know, roll things simply, do not flush them up in the air. What else you would be doing? You will be asked also to have one shift with physio and one shift with the lifestyle, okay? Why you will be asked to attend those shifts? Because when you will be working as a nurse, when you finish the whole Diploma of Enrolled Nursing course, you will need to know aspects of what physios do for patients, for example, especially for elderly patients. What is the role of lifestyle in aged care community as well? What do they do? Why they are there? You know, why are they important? So basically, physio, the job of the physio and its role in aged care facility is to assess and reassess the residents. Because when the person just comes first time to the aged care facility and resides there as a resident, we need to assess the person. So the nurses will be assessing the person from the clinical point of view, and then the physio will come and assess person's physical abilities, to see whether the person is using a wheelie walker, whether the person needs to still use a wheelie walker, because a lot of people will be living at home before they come to the aged care facility alone, or they were living with someone who, for example, a member of the family, like a child or something, who is an adult and been working all the time, not paying too much attention to their grandparents or to the parents who've been old. So that person was never assessed properly. The person could have been using a wheelie walker, but always falling with wheelie walker, because wheelie walker is no longer enough for the person to stay safe. Maybe the person needs to be now by 2 assist of the carers and be using only steady to be transferring from bed to the chair, and so on. So many people will come with different physical conditions. So the role of the physio in the beginning will be to assess those people and see whether these people need, whether that person needs a wheelie walker, whether that person needs crutches, whether the person needs just a stick, or the person will be on a steady or a standing hoist or a full hoist. So that's very important. Then throughout their stay in aged care facility, obviously they already come in an elderly age, they get even more older, and some of them have pretty fast decline. So some of them will be declining in their physical activities, which means if the person came in the beginning using a wheelie walker, after a few months period of time, the person legs became too weak. Some people have arthritis, pain in joints and stuff like that, and all of that is just decreasing their ability of using something that they've been using before. So the role of the physio in this case will be constantly reassessing those residents and seeing whether that resident needs a different tools to be used to transfer from bed to the chair and so on. Maybe, as I mentioned, it will be a steady, or a standing hoist or a full hoist. Also, what I wanted to mention, sometimes physios, not sometimes, I think probably most of the time, physios will be listening to the advices as well from the carers, because carers, they spend most of the time with the residents on a daily basis, so they know when the person, for example, is starting to decline in their mobility. So they would write a referral in a special referral book to the physio to assess such and such patient, and then the physio will come and assess the patient and might find out that the patient is really, yes, declining, so something needs to be changed in the mobility chart and stuff like that. So that would be the role of the physio. Also, what physios do, they provide every day a morning activities, which is a little bit of exercise to all of the patients or the residents, and that could be individual or that could be done in groups. And this is really important because most of them would spend a lot of time by just sitting or lying down in bed, even though aged care facilities have so many different... Sorry, my phone just turned off again. I have to change something in my settings. I don't know, after every half an hour, 20 minutes, it just turns off by itself. So what I was saying, that the other thing that the physios will be performing is daily activities. It's exercise activities where a group of people or individually each person will be doing something for their muscles basically, and for the bones and stuff like that. So they will have morning activities which will be scheduled every day except weekend. It's going to be in a form of exercise or in a form of game, and the residents will have ability to maybe throw the balls or to lift up their arms and stuff like that. So that will stimulate their muscle activity, their bone activity basically, and just keep them active, you know what I mean? Because most of them would spend a lot of time sitting in recliner chairs or on beds, even though each facility has a really nice program of activities throughout the day, but yet some people would prefer to just sit and watch TV, and it's their own choice because this is what they want basically. So physio's role will be to take those people and do some physical exercise with them, just to keep them active and keep the blood going through the muscle, and just, you know the saying, when you don't lose it, you lose it. This is it. So we want them to use it basically. Then sometimes physios will be taking part in lifestyle. So lifestyle, it's basically a group of people who work as a lifestyle carers or lifestyle representatives. What they do is they plan different type of activities for residents. That will include games that physio will be attending as well as an assistant. They will be creating high teas parties, which is really cool. This is when they serving really beautiful cutleries and really beautiful china glass and stuff like this, cups and plates, you know, and they have this high tea in a really nice table. So it looks like a nice restaurant. Well, all the residents will come, have a tea and nice biscuits and cakes and sweets, and it's so cute. Like, it's really, really nice. In France, usually once a month. Then they will have different games planned. Then they will have excursions planned. So basically we will have like once every 2 weeks or once a week for different household or for different unit excursion planned, either to Glasshouse Mountains or to the museums or to parks or to the beaches and stuff like that, which is really, really cool. Then they will plan a movie. Okay, basically we usually have movie every Sunday. Okay, and then they will be planning sort of other activities like coloring, you know, knitting for women, you know, crafts. Like when the holidays come, like seasons like Christmas or Easter and stuff like that, you will find them planning for residents to do all sorts of crafts, you know, including cards, you know, to give as a gift to other residents, to exchange with each other. They will be doing different paintings. They will be doing little pockets for the napkins to put on a table when Christmas comes and stuff like that. They will do all sorts of decoration that will be after that held on the walls, on the windows and stuff like that, so everyone can see it. So it's so much fun. The role of lifestyle people is to basically entertain and make life of residents fun and happy and exciting while they are staying in aged care facility, because for most of them it's such a big change when they move from their own home, when they've been living for years. They know every and each corner and bit and piece of their home, to a completely new environment when there is no family around every day anymore. You know, they don't have their neighbors all the time who they used to talk to, you know, maybe every day. You know, some of them will need to give up on pets and stuff like that. So lifestyle people, they would want to make their experience as happy and as pleasant as it could be, to make it interesting for them to stay there, you know, and just make them busy with something. So as the other members of the aged care facilities, including carers, nurses, physios and stuff like that. So you as an enrolled nursing student will be asked to have one shift with lifestyle people and one shift with physios, to just see what they do and how it implements the lives of patients. Basically, it's really interesting. You will really enjoy it. It's really nice. Then I think that would be it pretty much for your tasks to do. If I've forgotten something, please remind me. If you've done this Diploma of Enrolled course before, if you have any questions as well, ask me and I will try to add it in the comment section below, because I'm trying to remember each and every piece of what I went through to share with you. But in general, these are the most common things that you will be doing. Some of you might ask, will I be doing medications or dressing changes in your first placements? No, you won't. You will not be, because this will be covered in your semester 2, which will be dedicated to your medication administration, and then semester 3 will be dedicated to your dressing, changing and wound management in general. So you're not going to be asked to perform those tasks, but you can actually see your nurse while she's doing or he is doing the dressing, and just watch and learn, you know, as something prior to what you will study in your following semesters, because it's always interesting to look at something that you can't do but you will be doing in the future. So why not? Nobody will tell you no. They will allow you to watch and they will explain you, and you can ask actually questions and stuff like that. I remember on my first placement, when I had few people, you know, having a skin tear or for whatever reasons, you know, they scratch themselves, you know, or they hit something and stuff like that. I was really interested to see what type of dressings the nurses were using, you know, how they were cleaning the wound and stuff like that. So yeah, it's a bit fascinating. Then also, when you perform your OBS, there is something called, when you have a fall, when the resident has a fall, you will need to perform OBS on an ongoing basis for the first few days. So you might be performing those OBS as well, because it is very important to watch the condition of the patient. The patient is not declining, you know, in any means and stuff like that. So this will be one of your OBS as well. When you start your shift, I should have probably mentioned this in the beginning, you will be buddied with someone. So all those tasks that I've just mentioned you will be doing, is basically you will be buddied with a carer or a nurse. Most of the time in aged care facility you will be buddied with a carer, which is AAN. Okay, that carer knows the residents, okay, and that carer will be guiding you and just helping you and answering all your questions, and that carer will be telling you what to do as well, because again, they've been in the industry for a long time, they know the residents, they know how to perform tasks, they know which and what each resident likes, so it will be easier for you to just be guided by that person. Also, when it comes to clinical observations and BGLs and all of these things, you will need to do this under supervision of EN or RN, because this is not something that carers would do. So for those tasks you will need to actually talk to your ENs or RNs, you know, take the old machine, you know, and do BGLs, take the kit for BGLs and stuff like that, and perform that. For some of them you don't need to have a supervision, you know, so you can just go, maybe first time you can perform BGL by being supervised by EN or RN, the next time you don't have to be. Just try to be careful, you know, follow policies and procedures, follow what you've been taught, and always stay in your scope of practice basically. So that would be it. You will need to be asked to be rotating between different households or units or whatever it's called. So basically each aged care facility will have different departments, or we call them household. Each household will have roughly from 20 to 30 beds, again depending on different aged care facilities types. Where I work and where I had my placement, we have 6 households, and each household has 20 beds. So you as a student, you might have 5 shifts in one household, then you will be rotated to maybe 3 shifts in a different household, and then you will have another 4 or 5 again in a third household, and then you will have your physio shift and your lifestyle shift. So you will have actually experience of working with different people all the time. So that would be different residents, that would be different staff members. So those communication skills that you've been learning in a class will be really useful for you, because you will need to know how to communicate not just with the residents but also with your work colleagues, because you need to stay professional, you need to stay nice and kind and friendly to maintain that nice atmosphere and then bond that you will have with the people you work with. Then you will be having few shifts for sure in lock-up dementia unit, okay? So most of the aged care facilities, they will have something called a dementia lock-up unit. This is for people who will have really heavy level of dementia. Some of them will have delirium, you know, hallucinations and stuff like that on top of their dementia. Some of them will have Alzheimer's disease, which is always under umbrella of dementia term, and depending on the level and the condition of dementia, some people will be allocated to stay in lock-up unit. Lock-up unit is not something really scary as it sounds. It's just a household with 20 beds that would basically have closed doors, because this is done for the safety of the residents who stay in that household, because with the level of dementia that they have, they might go out and get lost, they don't know how to go back and stuff like this. For their own safety, we just keep them certain, like in that household. But you will have other residents who would have dementia as well, but not as heavy as the ones who stay in lock-up unit. So a lock-up unit is a really nice and friendly environment. Is not that scary, to be honest, and stuff like that. Yes, some of the residents might get aggressive and stuff like that just because of their dementia you know, stage and condition, because sometimes they will have hallucinations or deliriums, you know, and they might hear maybe voices and stuff like that. But again, they have no control over it, and you can't blame them for doing certain things, you know, and acting in certain ways and stuff like that. I always feel sorry for those people, and I always have sympathy and, you know, like nice feelings towards those people, because again, any of us can end up like that when we get old. We have no control over it, you know, so we have to be still kind and responsive to those people, you know, and to be responsive to their needs and stuff like that. So you will have few shifts in there. You will have appropriate training before you go to lock-up dementia unit. All these aspects will be covered in one of your subjects during your classes before you start even your placement. So you will have a huge topics and lots of conversations about dementia, you know, in general and stuff like that. So you would know how to act, what to do and stuff like that. But my advice to you, when you do your shifts in lock-up dementia unit, always listen to your body, which is going to be your carer, because carers who work with dementia residents on ongoing basis, they know every bit of what they like, you know, of how the behavior is. They know all the signs if the person gets agitated, so they know all those signs, and they will tell you that, you know, if that person has the sign now, please just leave that person alone till the person comes down, you know, or they will tell you like what to do and how to approach certain people in that unit. So just always listen to your body who works with you, because they can give you really valuable advices, so you would do things right. Okay, then so this was regarding your tasks and stuff in general. Regarding your facilitator, as I mentioned before, you will have a separate facilitator during your placement. This facilitator will be with you there all the time, every day, from the beginning until the end of the shift, and most of the time you will see this facilitator during your breaks. So she will organize for most of you to sort of like get her on the same lunch break. Usually it's from 12:30 till 1. This is your main lunch break, and this is when all of us gather together, and while we're eating we can discuss certain things, again, positive or negative reflections, you know, if you have any concerns or you had any problems during your shift, whether it's you and the patient or you and the body, you know, or any other colleagues, you can discuss all of this with your facilitator, and then she can advocate for you and go and speak to someone if you had a problem with that person or you had some misunderstanding and stuff like that. If you have any questions, she will answer that as well, and also she will guide you through the things, because your facilitator is a nurse. Okay, my facilitator was, I think she was CN. She's done so many years of practice being enrolled nurse and then RN and then CN, so they know what it's like. They've started by themselves from HK facilities as well, and they've been working their way up through to what they are now. So they've been in your shoes, they know what it's like, so they will answer all your questions and give you really valuable advices. Then before you finish your shift, your facilitator might withdraw you for another 15 minutes just to see how it's been going. Again, if you have any questions, so it will be really similar to the one that was during lunchtime, but this one will be already, you're not actually busy chewing and eating and you're having conversation. This will be dedicated more to a whole group conversation, you know, with other students, and it's like a conclusion to the shift during that day. Then you will have your handover in the beginning of the shift, and you will have your handover in the end of the shift. Handover, it's when you starting your shift, and the carers who've been finishing their shift earlier, they will tell you what's been happening with the residents in that household, what tasks been done, if there's any change in healthcare conditions, if there's any change in medications and stuff like that. They will tell you if someone been away, or someone been taken to the hospital, or someone came back from the hospital, if someone's physical mobility has been changed by the physio and stuff like that. So all those changes in staff and things that have been performed to the residents will be held from one shift, from the staff from one shift to the staff from the coming shift. And then you, when you finish your shift, will be doing the same thing of everything you've done throughout your shift to the next carer who will come to perform the next shift. So you will have morning handover, and before you finish your shift handover. Usually it takes from 10 to 15 minutes, and this is happening everywhere, in the aged care facilities, in GP clinics, in hospitals and stuff like this. This is something that is, I should say, mandatory. Everyone should do it. I think this is it for that. Then also something that I wanted to mention, I'm not sure if this is happening in every aged care facility, but in mine it is. We have something like a dot point system, which means when the students come to do their placement for 3 weeks, each week will have different dot system. For example, in the first week you will be not allowed to use any hoists, even if you are a second standing person. You will be just watching from the side, and you will be helping carers to, for example, do beds or to dress up a resident and stuff like this. So every week you will have a different dot color will be placed on your name tag. It's like a sticker, small dot sticker, and each one of them will have different color, and that color represents your abilities of what you can do, basically what you're allowed to do. So then on the second week, I think you will be able already to be second assist with the hoisting residents, which means you will be using set steady, full standing hoist or full hoist, and you will be one of the people who are actually operating the machine. So one carer will be operating and you will be the second one, because with all type of hoists, most of the time you will need 2 people to be doing the cares to the residents. So it will be your body and it will be you. And then the third week you will be like doing most of the things as all carers do, apart from if the residents still needed to assist you, you will be having second person with you, obviously, because not because of your dot points, but because some people will have physical abilities that will just restrict them from doing things with one person only. So you will need 2 carers caring for that person and transferring that person to certain places and stuff like that. So yeah, so that was in my facility. You will have this dot point. I think most of the things that you will be allowed to do in the first week with the residents will be feeding, you know, helping to dress, do beds, you know, do hygiene and stuff like this. This is like the basic small things, you know, and then you will be still doing in first week your OBS, your VGLs, you know, and stuff like that. So in your logbook, okay, in a reflection journal, as I mentioned in the beginning, you will be asked to write your reflection. So try to divide that reflections into each week. So basically you will have 3 weeks. Just write 1 reflection for each week, and this could be your negative or positive reflection. This is basically your experience, how you placement went, how did you feel during your placement, what did you learn during your placement and stuff like that. So it's like a diary, you know, when you've been a kid and you've been having your diary and you could write in your thoughts and stuff like this. This is it pretty much, you know. Just try to stay professional when you write it. Stay away from slang and all of that, you know, because these books will go to your upper registration, so just people will be reading it. So try to stay professional, but yet you can discuss your either positive or negative experience. You don't have to put only positive. If you had some negative experience, you can put it in as well. Okay. Also, for mobility diagram for each residence, when I was mentioning how you do your hoist use and stuff like this to transfer patients from places to places, in my facility we have a mobility diagram in the back door of the bathrooms, and this is mobility diagram is always updated by the physio. So if there is any changes been done to the mobility of the resident, it will be updated on that diagram. So it will tell you basically if you need to transfer person from bed to a recliner or to a wheelchair, which hoist or which mobility aid you need to use, whether the person is using a wheelie walker, you know, whether the person is on standing hoist and stuff like that, or a person just using a stick, or the person can walk. So, and also if the person is for a hoist use, most of the time it will be to assist. All of that is going to be mentioned in your diagram, and because you will be a student who do not know the residents, always refer to that diagram, because even sometimes carers by themselves, when they are rotated from different households, they can forget, or they can actually go on a shift when the change has been happening and they were not there during those changes, and they came on a shift and that person is no longer using a wheelie walker, that person now is a steady. So when people are old, they decline really fast. So for your own safety, you know, always do double check of the diagram on a back door, because for those reasons that I mentioned now, your carer might not be aware, or your carer might be so busy, because we're all human beings, we forget things, we get busy, we skip things from our mind and things like that. So you always double check as well. The next thing that I wanted to mention is a diet. Okay, you will find a lot of residents is on a diet, and this is not the diet like they're restricted from certain meals. Also, what that means is that there are different textures. There is A, B, and C textures. Some people won't be tolerating big pieces and hard pieces of food. They will need something that is really soft, you know, mildly soft or really soft and stuff like that. Some people will be on a mashed food. Some people will be on thickened fluids. They can't no longer drink just the normal thin fluids because it will either go to airways, you know, or they just feel choking and stuff like that. So they don't have that ability to swallow food properly, so they will be on thickened fluid. So that means that you will need to ask your body, you know, the carer who is with you, you know, what is the level of thickening for each resident. You know, some of them will be 150, some of them will be 400, some of them will be 200. So you will have like a diagrams in a kitchenette saying, giving you description of each level and how many scoops of this powder. So thickener comes in a powder form or a liquid form, okay? So they will tell you how much you will need to put of that into the drink of the resident. So be really careful, because if you give to someone who is on thickened fluid a thin fluids, that person might choke and fluids might go to their trachea and reach the lungs and then create aspiration and pneumonia even as a result in the end. So just be really careful. Always ask your body who is from this residence in this household is on a thickened fluid, so you would know who to give it to. So this is really important. This is for your own safety, and this is for the safety of the residents as well. Okay, so in the end of your placement, you will need to make sure that all the tasks in your book are signed off by your buddies and by your facilitator at your placement. This is really important, because once is all of that done, then you can return your book to your facilitator at TAFE. Because if there is something hasn't been signed off, you will need to go back again to the facility, look for that buddy nurse that been witnessing you doing particular task, and sign it off again. And you know, many of the nurses and carers work in different times, so it's going to be a pain in the butt basically. So make sure when you before you finish your placement by a few days, make sure that all your tasks are signed off. If there are some tasks that, for example, for some reason couldn't be signed off, for whatever reason it is, you know, you didn't have a real situation life scenario to do it, you can speak to your facilitator at your placement and she can simulate the scenario for you, and you can answer questions from that scenario and pretend like you would do it, you know, and tell you what would you do and how would you do it, and she will sign it off for you. That happens, yes, sometimes it does happen, but there is always a way to solve it. So once you made sure that all your book is signed off, then you will need to get the final signature from your facilitator at TAFE, and this is happening when you have your debrief session. So once your placement is finished, you will be given, before it's even finished, you will be given on TAFE Connect dates and times for your debrief session, as it was happening with your pre-brief session. In this debrief session, you will need to bring your logbook and you will need to give it back to your TAFE facilitator for the final signature, and then she will need to check if you've been attending all your shifts and stuff like that, and she will sign it off as a final signature. And then also during your debrief, you will be given a survey that you will need to answer a few questions in it, like, were you satisfied with your placement? Did you have any problems? Were you receiving support? Were you receiving opportunities to perform your tasks and stuff like that? So you will need to tick all of that. You don't have to put your name on a survey. This is sort of like a anonymous survey, so you can actually answer it honestly, you know, and this is just provides for them a background whether students are happy and receiving all the support and whatever they need in that facility. And also one of the questions will be, were you happy with your facilitator? Was she supporting you and helping you and stuff like that? So that will give them a little bit of knowledge as well, whether the person that they hiring to be your facilitator at your placement is doing the right, is doing their job correctly basically. So after that survey, you will have sort of like a group discussion, and your facilitator will ask you, did you have any problems, you know, did you have any conflicts with anybody, were you happy in general with your placements and stuff like that. So if you had any concerns, or if you were not happy with your facilitator, or if you had some arguments with some of the colleagues and stuff, you can just speak to your facilitator and address all those points. Also, during your placement, they would tell you that in a pre-brief session, that if you would have any problems, always speak to your facilitator at your placement. If that facilitator cannot resolve it, you can always call TAFE to your TAFE facilitator, and then she will call the facility and see what can be done. I've never had any problems like that. Like, all my placements and all my diploma went smoothly. I never had any conflicts or problems with any of the colleagues I've been working with. I never had any problems with facilitators. So for me, it was like, thanks God, it was all right. But if you experience any of the problems, there is a solution for it and there is a help. So don't be frustrated or scared and just keep it inside and keep going. No, you have to talk to your facilitator at your placement, and if not, then talk to your facilitator at TAFE. As I said, there is always a solution and they will help you. So this will be your final step of your placement, basically your debrief session, you know, and then you will have a little bit of the holidays, and then your next semester will start. Well, I think this is all what I wanted to cover in this video. I'm sorry if I didn't stay consistent with some of the points and I was going back again to certain parts when I was remembering things. It's really hard to just give you all information like in steps without messing it up, because this for me was already 1.5 years ago, and it could have been that I've forgotten some of the parts and stuff like that. But I tried to write down all the points that I remembered, you know, and things like that. And now at the moment I work in an HK facility still, so most of these things are still relevant to me. So I try to give you all the information that I still have, you know, in my head and I still see every day. But if you have more questions, please leave them in the comment section below and I'll try to answer it. But pretty much don't be scared from your first placement. It's really exciting opportunity for you to try to practice all those things that you've been learning in class, but this time on real people. I know it sounds frightening because it's real people. You might think, oh, what if I do mistake, you know, they're real people, you know, I don't want to hurt anybody and things like that. Always remember to stay safe, okay? This is your first priority and first thing in your head when you perform anything. Just stay safe. If you don't know something, don't be shy or embarrassed to ask your buddy or to any nurse. If you don't know something, they're not going to be judging you for that. They're not going to be thinking that, oh, you've been studying this in a class, how come you don't know it? No, they're not thinking like that. You know, they, like you, they want everything to be safe during their shift. So when they're budding you, it's their responsibility that you will be doing your work safe. So it's actually even better for them if you ask them questions. If you're not sure about something, then if you would be doing mistake and you will be harming someone, because they are the one who will be responsible for your actions as well. And of course you will be responsible for your actions as well. So always try to be safe, you know, always stay in your scope of practice. Do not do things that you're not supposed to do. Again, if you're not sure, just ask someone, okay? So that's pretty much it, I guess. Thank you for watching this video. I hope it was interesting for you, and I will make more videos because I have the full list of things that I want to talk about, and hopefully I will have time to at least do half of it before I start my uni, because I will have really busy lifestyle again after I start my uni, as I'm still working. So yeah, I'll try to record as many videos as I can during my holiday time now, and I will share with you all this information. So for now, I'll see you in my next video. Bye.